that. So first and foremost, I want to introduce myself. I am Brittany Becker, licensed mental health clinician, and I'm the director of the Dorm. And I'm so excited to have everyone here today with me with our recovery roadmap specialist. We have Ibbits Newhall, Wendy Wright, and Becky Henry, and they're all going to chat with us about, as you all see on your screen, the 3 keys to help families go from panic to plan. Really diving in to an introduction of helping set this roadmap for our families who are looking to help their loved ones get into treatment for eating disorder or disordered eating. So just to kind of do some housekeeping, I have a couple of things that I'd like to share, and then I will share a little bit more about the agenda and pass it right on to Becky. So for everyone, this is going to be roughly 30 minutes long. We will move into questions at the end. However, please feel free to put any questions you have as we go in the chat, and we'll make sure to find time either in the middle or towards the end to jump in and answer those. This is recorded, so if you'd like to keep your questions anonymous, please also feel free to put it in the chat. Otherwise, at the end, we're going to choose people right from the audience to ask those questions. Also, lastly, at the end, we'll be sending all of these slides and the recorded session to you all. So if you missed a piece, if you're writing notes, don't worry, you're going to get this in your emails. So without further ado, the main areas that we are going to be hearing from our panelists about is being prepared, the financial realities, and also how to really help support the anxiety that arises from the families that we're working with as they're helping their loved ones get into treatment related to eating disorders. So I will pass this on to Becky, who is going to share a little bit more about our recovery roadmap specialists that we have here and continue with our presentation.
Sounds good, Brittany. Thank you so much. Yeah, you know, Wendy and Ibbits and I all saw a need, a really dire need for an emergency roadside kit for families to feel less isolated and fearful, you know, so that they could be calm, compassionate, confident caregivers and be an effective part of your treatment team.
Thanks, Becky. I'm Ibbits Newhall. I'm a treatment resource consultant. And if we could get the next slide, that would be awesome. And what I'm going to be talking about is the first of the 3 keys, taking a breath to map out the strategy for families and with families. But at this moment, I also want to take this little breath to pause to recognize the moment that we are all currently in the behavioral health care field. We know that all of you are feeling it very, very keenly. And certainly in the eating disorder realm, we're just seeing an enormous uptick in acuity and need. And it feels like everyone is on thin ice right now. Even caregivers, even professionals we're all overwhelmed in trying to help the people that call us, that come our way. So we so appreciate your taking the time out of your very busy days to talk with us about this very important topic. So if we could have the next slide, that would be terrific. And so the first key, and there are several subheadings in that, is being prepared. How do you help a family get ready for this decision making? And the first of those is really understanding as a professional and helping the family understand what the urgency of the situation might be. How severe are the behaviors? You as a clinician, or if you're an individual or parent watching this today, you have your own eyeballs, you have your own spidey sense. But what are some of the other things that you need to know? We always recommend really getting a qualified medical professional involved so that you can get that data outside of what you're seeing with behaviors and seeing with your own eyes. A shout out to the Alliance for Eating Disorders Awareness. They have an amazing lab coat guide for medical professionals. So if your treating professional does not have this information about specific labs and how to look at them, this is a great, great guide and tool. And spoiler alert, even with all the labs, even as sick as someone can be, sometimes the labs come up just fine. So that's when the totality of the clinical team, the medical team, really looking at this case and really beginning to tease out what's going on is super helpful. So all that conversation among you is essential. Understanding the frequency of the behaviors. What are those? It can be restriction. It can be purging. Purging can be anything from what we think of, or it can be compensatory over exercise. It can be laxative use. There are a whole range and flavors of behaviors across the spectrum. So being aware of what those things are can also help you in guiding the family about what kinds of programs might be best. What fits the diagnostic profile? What are some of those comorbid conditions? Whether it's mood, OCD, which seems to be a very frequent traveler, mood disorders, self-injury, suicidality, substance use. There are a whole range of things. And even certainly in the families that come my way, I'm sometimes seeing, very unusual in common terms, other kinds of presentations, which can further refine and define where somebody is going to need to go. And so you're helping that family and guiding them as they're getting all that data. And I always think that the data is a key part of all of this decision making. And at that point, as we're beginning to drill down on what's going to be necessary, what are some of the questions to ask treatment programs? And if we can skip to the next slide, that would be terrific. And this is just a very shortened but headlines kind of list of some of the things that families and even you as a clinician might need to ask. And this is going to be some of Wendy's realm, but when it comes to insurance, what is covered? What is the typical length of stay? What are those terms like maximums and out-of-pocket costs? Wendy's going to talk about that in some more detail, and it's wonderful the way that she digs into that and defines it all for all of us, not just families. What is a particular program's wheelhouse? How is the treatment of these comorbidities and other disorders addressed? And, it's really important to ask those questions, because even if you've been given a lovely list, it's really essential to know the details about how those particular areas are dealt with within the program. What are the program's medical and psychiatric capabilities? What are the program's nutrition philosophy? Each program has its own particular way sometimes of delivering this kind of message. You'll hear terms like plate by plate, or you'll hear exchanges, or mindful and intuitive eating, or conscious eating. So it's really important for you as a provider to understand what that program might provide and help guide the family. And it's important for the family to really understand what that philosophy is, because the food does become a battlefield, and it's really helpful to know those things beforehand. And you might crack up at this. What are the policies about bathroom breaks and electronics? And you would not think that this is as important as it is. When are they going to be able to call mom and dad? Are they going to be able to get on their computers and devices? How does the program deal with that device use? Is there limited time? Is it after programming? These are all things that are really, really important to know. I always chuckle that even as long as I've been doing this, I feel it's the one question that I've forgotten to ask that always comes up and becomes a bit of a situation. So this is just a bit of a highlight, but it's also very important to know how to guide the family about what to anticipate in terms of length of stay, what the program thinks those necessary next steps will be. And when I'm also, if we, in going back to my little agenda, and we don't need to go back to that slide, is what is it that families and providers can expect? What will the family work and support be like? Those are questions we need to know. And how does the program work with the outpatient providers? Because the outpatient providers have that often very in-depth knowledge and really extraordinary insight into what makes this individual tick. What kind of communication can everybody expect? It's so important to have that communication between the outpatient providers and the program, as well as the families. And this is a realm that Becky references quite a bit, is how to make sure that all the stakeholders are included and feel that they're part of the collaboration. Again, as I said, what is the possible length of stay? What might be the typical step down options? Do they have their own? And what might that look like? Because the more information that you have front loaded, the more information the family has, and the more information that you have as a clinician, the better able all of us are to proceed calmly, to take in the treatment, and to get as much out of it as possible. And I'm trying to remember this is an important part of the communication. What happens when things go sideways? How does the clinical team help that residential treatment team? How does the family collaborate with the program and with the home team? So all of these things are really important to think about ahead of time and to ask those questions. Number 4, what to expect about length of stay. One of the things that we talk about a lot, and I'll be wrapping up in just a sec, is how not to rush the process. It's really, really important to understand how long it's going to take and not to take shortcuts. And again, the really important thing is that the outpatient team, the family, and the residential program are collaborating. And if you are working with a family and you don't hear from a program, get in touch with them right away, because it really works best when we're all firing on all cylinders. And with that, I'm going to turn it over to Wendy. And I hope I didn't cut into your time as much. I meant to time myself, but.
Oh, not at all. You did great, Ibbits. Yeah.
So over to you.
Thank you. Thank you. Hey guys, I'm Wendy Wright. I'm a licensed marriage and family therapist and also a certified eating disorder specialist. I'm also a financial therapist. And for many of you, you can even raise your hand if you want to. If you've never heard of financial therapy before, it's a relatively new niche of therapy, but it is so helpful to approach the finances of the recovery process in a therapy with a therapeutic lens. And that's part of why, as you guys are finding out, when Ibbits, Becky, and I decided to put together this webinar series, that was part of what we wanted to really touch on. I've worked with many eating disorder clients and worked in the family role in treatment centers before as well. So worked with a lot of families. We wanted to bring, and we're giving you sort of the tip of the iceberg today in the webinar series that we put together. We cover these in depth, like the information Ibbits just brought up is a lot of what's in webinar 1 in terms of like both adjusting to the reality that that treatment is needed, like that's a big deal. Coming to terms with the beginning, middle, and the before, during, and after of treatment stays is how we broke up the 3 webinar series. It's a lot of information. It's the kind of thing I would even say for families to listen to maybe 10 or 15 minutes at a time, let it absorb because of all the details we put in there. when I'm coming to people to talk to them about financial therapy, one of the things that we want to start with, I think it's foundational to, and if you're familiar with intuitive eating or those principles, you'll kind of hear an echo of it, but is to come into our relationship with money with abundant, compassionate curiosity and zero judgment. That is really important all the time, and it's especially important when we are in a place of crisis. So one of the first things that I recommend for people to understand is know who you are, know what that means, know what your money mindset is. What is your go-to beliefs about money? And if this is something you haven't really tapped into or touched very much, there's some great resources, both on my website, online. You can find money mindset quizzes, things like that that really help, because whatever your money mindset is, and I'll go with one of the basics that people will hear a lot about is a scarcity money mindset, which kind of shows up in the brain as there's never enough money. If whatever the money mindset is, that will be basically magnified in a time of crisis. If you understand, kind of realize when you're in a time of crisis, you might really lean toward more all or nothing thinking and feeling like, how do I make these decisions? Or another common thing that will happen is the desire to throw all our resources at that first treatment stay. So taking a deep breath, and Becky's going to do a great job coming in after I get everything stirred up about money and helping people take a deep breath and get calm again. But when it comes to this, it's really helpful. There's a couple of key points that we have found that are really great to have in mind. One of them is to pace yourself. So first, know your money mindset, but realize it's going to get magnified. The next one is pace yourself, because the unfortunate reality of eating disorder treatment or severe mental illness treatment is that one treatment stay is more rare. It is common for there to be multiple treatment stays. And so it's really helpful when you're looking at making your decisions to keep that in mind, to pace yourself, to balance out, to build a plan for a multi-year. And I'm sorry, I know you just probably collapsed inside when I said that, but we want you to know this, to be able to plan for this is going to take years. And that does not mean by any means that anyone is failing at the process. So we want to come in with that compassionate curiosity and zero judgment. We want to plan for this to take years, to take time, and also to recognize that there's a lot of things to know about insurance. So one of the things I like to say about insurance too is know the terms, know how it works, but also, forgive yourself if you don't know these things. Be kind to yourself, have compassion. It is a learning curve. There are a lot of terms. We've even thrown some around today. You want to know length of stay. You want to know, are there out of network benefits? You may or may not have heard of a single case agreement. These are all tools that you can have to work with your insurance company to perhaps get more coverage than you thought you could. And to also understand, like, how is this going to play out over a year? And again, in the webinar series, we dive into this in a little more depth, but I think it's really helpful to recognize right off the bat, we want to plan for this to be, to go years and not months. We want to know how to work through the insurance system to maximize any coverage that's available there. And we also want to recognize that the outpatient care, so there's a lot of energy around a treatment stay at a facility, whether it be residential, partial hospitalization, even IOP. What is recommended after that is at least a year of outpatient. And that's week after week after week of perhaps co-pays. Maybe you've hit your maximum out of pocket, which is a really great place to be, because then it doesn't cost anything else the rest of the year. So you want to know what those are. You want to be able to prepare for the fact that your loved one will probably need multiple appointments a week to a therapist, dietitian, family therapy, at least weekly, every other week, something like that too, makes a big difference. So knowing that all those are there, you can plan those out, map them out as a part of your overall financial plan, and look at your resourcing and how you want that to impact your the whole system as well. So we've got these three things: know who you are, know your money mindset. And again, there's a lot of resources to figure out what is my money mindset and how that looks. It's kind of where we start in financial therapy sessions. Prepare for this to go long-term, and get some help understanding the insurance system. as well. These are great things, and just know that you have resources. Our webinar series, there's other resources to help you figure out some of the financial realities. So now we've talked a little bit about money and how this can go. Let me turn it over to Becky and she'll bring in some calm for you.
I feel like I need a little breathing after that, Wendy. No, you did a beautiful job explaining it all, and you're so compassionate with families. I love that because it can be such a daunting process. So, how do we get calm when we have a child with one of these life-threatening illnesses? I often feel like I'm asking a parent to flap their arms and fly to the moon, but that would be impossible. Being calm is actually possible, okay? It takes a lot of work, dedication, support, practice, and practicing being calm is a goal that is worth working towards for family caregivers. Why? Well, excuse me, when parents and other family caregivers are calm, it benefits not only them, but it also benefits the clinical team and the person with the eating disorder. But the clinical team sees the family as being less fearful then. And it helps them as the team be more effective and the family be more effective. It also helps the families listen better. When we're, Wendy shares in our series, when we're in a stress response and that fear response, we hear, is it 1 out of 5 words, Wendy? Is that right? Every 5th word?
Yes, it's a very important statistic that I made up, but it makes a lot of sense because we don't hear everything when we're stressed. It's like our brain drops every 4, word. Yes.
Thank you. I just thought that was phenomenal because I remember being there and thinking, I can't even take this all in. I have to take notes. So taking notes is good. That's important. So being calm really does help us listen better and be less reactive, and also can help us be able to tolerate our child's distress more effectively and more easily. And for the team, it's going to help you receive less frantic phone calls from the family in distress, so you can spend more of your time helping their children with their needs while they're in treatment. In addition to listening more easily when we're calm, we also learn more effectively. And, we can help them learn about the eating disorders more effectively when the parents are calm. Parents will say to me, I think someone told me that, but I just, it was so hard to take in everything they're saying. And many times they'll say to me, I was in such a stressed out state. I couldn't even believe that they told me this could take longer than a year. So if we can, really help them, it'll make everybody's job easier, and because they won't be so confused, and they'll be more effective in aligning with the goals of the treatment team. The family caregivers are also able to trust the team and their loved one more when they're calm, and they can allow their child to do their process without pressuring them or giving in to Ed's demands. I've had scared parents say to me, I know I shouldn't have given in because it was an eating disorder, but I was so scared. And parents do enable out of love and fear. It's both. And so when we can help the family manage their fears instead of telling them to stop enabling, they can be an effective part of the treatment team and help your treatment outcomes improve, which is something we all want, right? It's a great benefit for everybody. So can we go to slide 2, please? Or my second slide, I should say. My key 3 on calm for caregivers. This parallel process, a lot of times parents will say to me, I just want the treatment team to help my child and I need to go take care of these other kids, do my job. I have a big, huge job and I've got to do that. And what I tell them is, I get it. You have a lot of other things, lots of plates on sticks. And when the parents and other family caregivers work on their parallel process while the loved one's in treatment, the treatment outcomes do improve. I've seen this over and over again for the past 18 years, and just consistently when these family caregivers that I'm working with in my coaching practice actively work on and are supported in doing their parallel process, their children dramatically improve, and most have no more eating disorder behaviors. It just blew my mind when I started seeing that. So what exactly is this parallel process I'm talking about? There's a handout that accompanies the Recovery Roadmap series that lists many ways in which the family can do their parallel process. I'm just going to mention a few today in this high view of it at all. But first and foremost, we can encourage the family caregivers to be gentle with themselves and not allow the fear to drive the car, right? I'm just going to drive off the road if fear's at the wheel. And it takes a lot of support and accountability and having safe spaces for them to just spill everything they need to say. There's so much to spill. So together, we can teach caregivers how to practice breathing very often so they can learn how to best support and do the next thing, like making that phone call to the insurance company. There are so many breathing techniques that families can learn, and many of them have told me they just love using them, and they'll say, oh, it was 4 a.m. and I used that tool that you taught me and I actually fell back asleep. So it's really hard for these really competent folks to allow others to help them. And yet when we teach them that it's important, they can become more able to accompany their loved one and not try to fix them. These people love their kids so much, and they just want them well. So it's hard to choose courage over comfort and put ourselves on our to-do list. These parents all tell me, I was erasing myself. I took care of everybody else, and my needs weren't even on the list. And that's when they get depleted and bitter and angry and aren't effective. And life just becomes miserable all around. So it really helps these family caregivers to find others who understand, so they don't need to feel so isolated. It's so isolating as a parent when you have a child with an eating disorder. And when they can get that support to actually put themselves on their to-do list, and don't get erased, they are just amazing in this long, arduous process. They have the stamina to go the distance. And again, this works best when they have support and accountability. Those are vital. They just cannot do it alone. And that accountability to practice the self-care. I had one mom tell me that she listened to me talk about self-care for 1.5 years, and finally she went, she's just not going to stop, so I'm going to try it. And she said, everything changed. Everything changed, because I don't. I always talk about self-care, and I practice it myself. And then they can learn to listen to their gut instinct. They know this child better than anybody else on the planet, and their gut has some good info. And they also need to give themselves permission to make mistakes. And that's hard because so much is at stake. So while working with the treatment team, these family caregivers do well when they read and educate themselves, have that support and encouragement to believe in hope for full recovery. We can always remind them, it is possible. And I tell them all the time, I know lots of people who are fully recovered. So many of my colleagues are fully recovered. It does happen. And then it can really help them to remember and to be reminded that they need to schedule time alone to refill their empty cups. And together, we can all help them release the fear and believe that full recovery is possible for their family member. So will you please give me the next slide there? Thank you. And now to boundaries and next steps. Ooh, more breathing. So this coming home part absolutely terrifies parents. And they've been plugging along and learning how to do everything and learning about eating disorders, accepting the reality. And then all of a sudden they're like, they're coming home. I don't know what to do. So the more we can prepare them, the less on fire their hair is, the more confident they'll feel, and the smoother the transition will go. They need to be armed, though, with all the skills to hold loving, firm boundaries and not give in to the eating disorder. So how do they do that? Well, having written and discussed agreements with clear, measurable boundaries and logical consequences. Okay? These need to be loving, and the family caregivers need to be willing to follow through. That is key. But to be willing to follow through, this needs to be in alignment with the family caregiver's values. And a lot of times people will tell me, I don't even know what my values are. So we'll work on those values And that's my individual coaching. We don't really go into that in the series, but once they're clear on their values, then it's a lot easier, because it's like, oh yeah, my value is not going to work to say my kid has to go out on the street if they don't follow the rules. Great, let's find a different one. So they really need to get that spine of steel so that they can see the big picture and stick in there for the long game. This is not a short game kind of deal, as Wendy was talking about and Ibbits talked about. Those values are really going to help people make those decisions more easily and short circuit that enabling that decreases everyone's suffering in the short term and greatly increases the suffering in the long term. But that's really tough when your kiddo's sitting there in front of you really, really unhappy. So it takes daily loads and loads of practice of self-care to do all of this. And so that self-care can include learning to trust your loved one who has just done a ton of work in treatment while you're home doing that parallel process. And the families, again, who I get to celebrate their child's recovery with are those who've worked really, really hard on that parallel process. It's just vital. It's also important to be shining the light on their future. I always tell parents to pretend you're a lighthouse, like a lighthouse, not one chasing everybody around, like a real lighthouse in one place. And learning to talk about other things besides the eating disorder and food. And it's hard when it's just like, again, like your hair is on fire and you're just like, well, we got to talk about the eating disorder and the food. It's like, let's calm. Let's get that amygdala to stop firing like crazy. This is hard. Your amygdala is like Times Square on New Year's Eve. It's just, we've got to give that reptile brain a big dose of oxygen and then know that we've got this. And we can talk to the families, about helping their child see all the wonderful things that are ahead for them. Help them remember, oh yeah, you really cared about playing the violin. Great. Talk about some random thing about violins that you heard. It doesn't matter. It just normalizes life and gets them looking towards the future again so they can recover towards that. It takes massive, massive amounts of self-care practice to be able to calm that dear, sweet cave person brain that keeps us safe. And we really all want the family caregivers to stop spiraling. And if I had a magic wand to help us all with stopping spiraling, that'd be wonderful. But we can help families learn to self-soothe and not jump on that roller coaster. And you can get more pro tips on the Recovery Roadmap series and in the handouts. So I'm going to leave you with these thoughts. What if we could love parents just where they are at, just like we love the clients where they're at, while shining light on what's possible for them in recovery? Like Wendy shared about having abundant curiosity and lack of judgment. What if we love the parents in their human mess and their humanness, even though they're swimming in diet culture? What if we love them where they're at and shine the light on recovery for their kids and give them the education, support, and accountability that they need to be able to confidently and competently support their kids when the team sends them home? So that's my high-level overview of my 3 parts of the hour-long webinars. And as Wendy shared, parents can take these in 15 to 20-minute increments. It can feel daunting to think about watching for an hour. Know that these can be watched in any length period of time, and we're also going to be converting it into an audio version. So I want to thank the dorm and pass it on here.
You're going to talk about resources, we've got a great list here, our little series at the top of the list, shameless plug. But all these are terrific organizations that have both groups and resources, some great books. So, we hope you will all avail yourselves of some of these resources. And I think Wendy's going to close it out for us.
Hey, yeah, we really hope that this has been helpful, whether you're a clinician trying to figure out where do I start, how do I help families. One of the things that we hear over and over and over again from families and clinicians who have watched, have purchased and participated in the webinar series is this is what nobody never tells. Okay, that's probably the wrong grammar.
Close enough.
These are all the things that families don't even know to ask and nobody tells them. We're hoping that you feel like it comes alongside and makes your job a little easier if you're trying to support families. We really appreciate the opportunity to bring some of these highlights today and help support you guys as you're supporting others. Brittany, how about I'll hand it back to you.
Okay, thank you all so much. That was just really, really eye-opening, insightful, and honest. I really have had such an amazing experience collaborating so far with Ibbits on many cases, and I look forward to hopefully working also closely with Becky and Wendy. And what they presented here, at least from my experience working with Ibbits, is truly what they are always doing. This is the message that they run by. Compassion is always at the forefront. And I've seen how helpful it is when working with families and collaborating together. So I feel really excited about all the information. I want to open up the chat box to anyone who has questions. And I have a couple of questions just to follow up with first. If we can go there, and as questions come in, I'll be happy to share them.
Fire away.
Okay. So one of the things that I would love to follow up with, and maybe Ibbits, you can start off a little bit. You had shared about this shortcuts and the importance of telling and helping families to understand that we can't be taking shortcuts here. Could you share a little bit more about why and what that usually looks like when they do try to take the shortcut?
Well, I think, anybody who's worked with families has seen that they get a distress call from their loved one. Insurance might be cutting out. There are a whole range of things, but often there's this drive to get back to normal. If we can just get back to normal, if our child can just go back to college, or if I can just start back at my job, or if I can just do these things, everything will be okay. And as one of my colleagues once said, recovery is like an infant. It is that vulnerable and that fragile. And so we have to support it until it's strong enough to live, breathe, walk, feed itself. And, another one of my colleagues, the wonderful Wendy Oliver-Pyatt, used to say, and I say this probably every day, to go fast, we have to go slow first. And what happens is that when people rush the steps, they don't do enough aftercare, or they jump right back to school after being in treatment. It's such a raw period, and I think the eating disorder is just, while someone's been in treatment, has been sitting around doing push-ups, getting ready, getting fit for the return home. And I think that when you talk to parents who've been through this a number of times, they will say, and I know Becky and Wendy will corroborate this, I wish I hadn't listened. I wish I had listened to the treatment team. I wish I hadn't believed my child. The person that was doing the talking was not my child. It was the eating disorder. I wish. And so this is what we are trying to say, is it's so difficult, but pump the brakes. Becky, Wendy, do you have anything else to add in some of your experience on that?
I will say I like to have analogies and metaphors, but I think one of the helpful things, as silly as it may seem, to compare treatment to is if you decided, like, while your loved one's in treatment, I want you to walk backwards the whole time they're there and recognize what a shift that is, because that is how hard it is to go from living in an eating disorder full time to having these, walls, locked doors put around it. You can't use it, and then you've got to come out. So, because sometimes when I was working with families in a treatment setting, we're trying to decide, do we do 1, 2, 3 more days if insurance cuts out, and we're looking at, and they have to look at the cost and how they're going to do all that. And I found it really, I personally wanted to know, what is the point of a few more days? And it all depends on each case, but sometimes it is just layering in another brain cycle of doing something different, and or making sure you're there long enough in the more structured environment before that the plan is in place for when you step down. That plan to be in place when you step down is super important, because that keeps as much structure as possible. Often when I talk about this, I'll talk about, I call it the intersection of money and milkshakes, when I talk about money and food and this parallel relationship, because underneath it all, we're talking about decision making. And there's more on my website if you want to dig into that a little bit more, because it's another like hour talk. I won't do it right now, but essentially we want to have as few decisions as possible for someone who's coming home from treatment. So if that means staying one more day, slowing down that rush to get home so that fewer decisions are there, that sometimes that helps put it in context. Because if someone, if the family member's never had an eating disorder, they're like, hey, I'm going to have a sandwich for lunch. Why can't you? And it's just not that easy. So hopefully some of that helps support why taking your time is important.
Yeah.
Becky, you want to add something?
Yeah, I love that, Wendy. And it's just like those extra few days can be a time when the families and the child and the team can sit and work out the final details of those agreements that I was talking about earlier. And oftentimes that doesn't happen till the very, very end. And I'm sitting there in my coaching sessions with these families working on this agreement. And they're like, but they're coming home tomorrow. And I'm like, you tell that treatment team that you need a family therapy session to hammer out these last details and have that support, to have the family therapist say to your child, here's the agreement. Here's what your parents can support. And here is what you could expect from them. And here's what they expect from you. That can just go so far in preventing a relapse or a slip. And then giving them that time to make those things, put that structure in place, and also that agreement, so that they don't have those decisions that you were talking about, Wendy, to make. They're all made before they come home.
Absolutely.
It's such a rush of feelings.
Yeah. Thank you all so much. I would love to open it up to the audience. If there are other questions that you all have, please feel free to put it in the chat and I can read them off.
One of the things I think that
question box, sorry.
Oh, okay.
Question box.
While we're waiting, I think that Becky referenced the importance of that aftercare planning. And while she was talking about the parallel process and calm caregivers, I think the more that is planned out in advance, and you've been able to, the treatment team at the facility, the outpatient providers, if the family has them, what is going to be needed to wrap around that individual. And the more time you have to kind of get some of this stuff baked in, the better. It's nothing's worse than having this fire drill at the end. And sometimes that happens anyway, as much as we plan. But I think here too is another way to kind of take the hot air and the anxiety and the fear and the hair on fire out of a situation. And so and for the family to really think about, and for the team to think about, what are some of those key elements that need to be present, and to get creative.
One of the questions that came in is, where can people buy the Recovery Roadmap series webinar?
Oh, funny you should ask. Ladies, we are at recoveryroadmaps.com. That's roadmaps with an S. And there are a whole bunch of different choices there. And you can go there and click on the link and find out, what you can purchase. And, is as both Becky and Wendy said, it's a lot of information. So we do recommend that families, or anyone who's listening, to do it in manageable chunks, to kind of take it in. And if you need to listen to it again, it's always a good idea.
Yeah, and I believe we're adding the affiliate program options and the leadership options on there too, for treatment centers and nonprofits and organizations to
exactly
those options.
When we first all started talking, and each of us were coming at this from different kinds of disciplines, and we were kind of meeting on Zoom, as Wendy said, we're kind of getting ready for 2020 and we didn't know it. And we all of a sudden had this aha moment because each of us were talking about the things that we were doing. And we thought, wouldn't it be great if we could pool all this stuff, this information, to give families a guide so that they would know as they were starting out what they needed to be thinking about. And wouldn't this be helpful? Because it's a lot of information. And even if they're working with a terrific team, not everyone has the time to sit down and say, okay, you need to do this, this, and this, and this. And so we had this kind of, ooh, let's do that. So it's been super fun.
Wendy, can I ask you a quick question as well? I think some people in the room, as at least I can speak for myself, as a clinician, the money talk has been hard, and it's so important. And everything that you shared is really, really helpful. I'm wondering if there was a quick tip for clinicians when you're saying to kind of recognize your own money, your money relationship before talking. What would be the first thing that you think someone, or one main kind of tip for a clinician to know, oh, that's coming up, that's a me thing?
Yeah, absolutely. That is the thing I would say is know your own money story. When I'm working with clinicians, training them to work with families, or I also do a lot of business consulting for clinicians, even trying to set up their practice. The tendency to project your money story on whoever you're speaking to is super high. So you want to notice if you're doing that. So if you're coming from a place of, I couldn't afford treatment, then you may decide that they can't afford it and may not, and then you might not even offer all of the opportunities that exist for aftercare or things like that. I would find that would happen for a lot of people. And it's really helpful to notice. So knowing your own money story is pretty key, pretty important, and not projecting it on whoever you're listening to. There's ways in which money stories get interwoven into the client's eating disorder that also is really helpful to recognize. So really learning that, for instance, if someone says that there's not enough money for aftercare, they may have a high scarcity story themselves. So it's helpful to unpack that a little bit.
Absolutely. Yeah. I have one more quick question for Becky. You spoke about, and I love this, putting ourselves on our to-do list when we're talking about the family, like, hey, what about you? And you talked about calm and breathing. If there was one thing that you said, we've heard a lot of metaphors that I think I've been taking note of that I'm going to use, right? What would be like one tool that you love to go to as when you talk to the parents, other than saying like, just breathe?
Yeah, because that's like, I remember the first person telling me to breathe, and I was like, yeah, whatever, why don't you go jump in a lake, is what I wanted to say. But, and most people want to say that to me when I say it. But I learned this one, I mean, in addition to like 478, which I think is fabulous, or 444, I learned this one on YouTube, and it was for kids, and it's super easy. And you just take your hand, your non-dominant hand, take your dominant hand, index finger, and trace each finger slowly. Breathe in while you trace up. Pause, breathe out while you trace down. Now, as you notice, I'm crossing the midline of my body, which is important, and I'm having a somatic experience of touching my own self with this finger to this finger. And I can see it, and I can feel my breath go in and feel my breath go out. And we can do this pretty much anytime, any place, and at any speed. And as long as you have two hands, you're good to go. You don't have to buy anything special. You don't need any timers. You don't need an app. Nothing. You can do it laying in bed. You can do it in your office when you're on a Zoom call down here. See, like I'm doing it right now. You don't even know. And it's like everybody's going to do this on Zoom calls now in their lap. It's like, oh my gosh, is this person ever going to stop droning on? You're just like, and if your child is like throwing plates, throwing food, screaming, swearing at you, and you're just like, you know what, let's take a little time out, sneak off into the bathroom, and do this 3 times, it's going to reset your whole central nervous system.
Thank you so much.
Love that.
As we wrap up this awesome hour, I just really wanted to send So such sincere gratitude to all three of you for leading this, and really, as someone in here so nicely said, putting all three of these pieces so cohesively together as they all work all together, and it's so important. That being said, I wanted to let everybody know, thank everybody for being here with us to hear us out. And I also have an update of our next webinar will be coming up shortly in all of your inboxes. And it will be led by Legacy and Juniper Canyon about attachment theory, which all of us also know is really important, especially as we're talking about treatment and families and everything, food, everything, it comes up. So please feel free to join us on that discussion October 28th and check your inboxes for that. And again, I want to thank Ibbits, Becky, and Wendy for joining us here today and sharing everything.
Thank you. The dorm does an amazing job, and you know, it's such a pleasure collaborating with you.
Absolutely. Thank
Great
you.
being here.
Thank you.
Hey, I hope everyone has a great rest of your day.
Thank you.
Take care. Bye-bye.
Bye.